Yeah.
Okay. There.
All right. So, hi, everyone. Thank you so much for being here and welcome to our workshop. I'm so grateful for the opportunity to talk to you guys today. So, my name is Raha, and my friend Gurpreet and I are going to be presenting our workshop, which is titled The Methamphetamine and Party Drug Industry as a Blueprint for Future Drug Markets. So we would first like to begin our presentation by acknowledging that we are settlers here today virtually on the traditional, ancestral, and unceded territory of the Musqueam, Tsleil-Waututh, Squamish, and Tsawwassen people, on which we currently reside and work on. We express our gratitude to them, and we value the opportunity to learn, live, and be here today with you guys on this land. So a little bit about who we are. So hi, my name is Raha. I'm a student volunteer with the Addictions and Concurrent Disorders group. I'm finishing up my undergrad degree at UBC, studying neuroscience.
And my name is Gurpreet, and I have a Bachelor's of Science in Biochemistry and currently doing research at the Addictions and Concurrent Disorders group here at UBC, looking into substance use and mental health research.
So here is an overview of what our workshop today is going to look like. We're going to be covering stimulants, meth in the last decades, party drugs, and mixing stimulants with opioids. We're going to be touching on the opioid crisis in the context of stimulants. And at the end, we're going to be answering any questions you guys might have.
So to begin, we're going to talk about stimulants in general. So what are stimulants? For those who might not know, I'm sure a lot of you know, but stimulants are a class of drugs that speed up messages traveling between the brain and body, stimulating the central nervous system, and includes caffeine, cocaine, amphetamines, and nicotine. And the effects are usually euphoria, heightened feelings of wellness, well-being, increased heart rate, blood pressure, increased alertness, talkativeness, reduced appetite. And it differs from opioids, where opioids are more sedative and cause respiratory depression. So our main focus in terms of stimulants will be on methamphetamine and party drugs like cocaine and ecstasy. So just a little heads up there, and I'll pass it off to Raha.
Thank you. So I want to touch on amphetamine type stimulants. So those are a range of drugs, including amphetamine, methamphetamine, MDMA and ecstasy, ephedrine, and prescribed drugs such as Ritalin and Adderall. These drugs are completely synthetically produced, and they're often prescribed by physicians to treat stuff like ADHD, obesity, narcolepsy. And these drugs can often have adverse effects. So they can range from things like restlessness to and blurred vision, all the way to more severe effects such as seizures, heart problems, mental health problems such as new or worsened bipolar illness, or aggressive behavior and hostility, and psychosis as well.
And that sort of leads into the conversation on meth. So what is meth? I'm sure a lot of you are already familiar with meth from Breaking Bad and other media, but methamphetamine or meth is a powerful, highly addictive stimulant, and it's typically cheaper than cocaine and more effective in its effects compared to cocaine. People can take meth by snorting, smoking, swallowing, and injecting, where injecting or smoking usually gives the user the biggest or quickest rush. Snorting meth results in effects within 3 to 5 minutes, while oral ingestion brings effects within 15 to 20 minutes. Snorting or oral ingestion doesn't produce a very intense rush, but rather a euphoric high, unlike smoking or injecting the drug. But yeah, that's sort of the picture on meth. And Raha can talk more on the effects of meth.
Yeah. I don't see the next slide.
You don't? Really?
Oh, it's right there, actually. Sorry, it was delayed. But yeah, I just want to reiterate the effects of meth, just because I think it contextualizes our presentation quite well. But on this slide, we talk about the different domains of the effects of meth. So we see the physical effects, like I mentioned earlier. There are heart rhythm changes, full body stimulation, nausea, which can lead to decreased appetite and significant weight loss. There's also psychological effects such as delusions, heightened self-confidence, aggression, and euphoria. And then we see that there's effects when it comes to extreme use. The heart problems, as mentioned before, seizures, addiction, and even death.
With now all that conceptualized, we wanted to touch on meth in the last decade, since the stimulant market is quite mature as it is right now. So Raha can talk about meth use in Canada.
So yeah, so as many of you may already know, meth use has been increasing in Canada, and you might also be seeing an increase in stimulant overdose in your line of work. But statistics from the Canadian Centre on Substance Use and Addiction shows that between 2010 and 2015, the rate of people seeking treatment for stimulants in a hospital setting increased over 600% in Manitoba, almost 800% in Alberta, and almost 500% in BC. So during the same time frame, rates of those hospitalized for poisonings in Saskatchewan, Alberta, and BC doubled as well. So though these hospitalizations include other stimulants besides methamphetamines, data from other sources leads us to believe that these increases are largely driven by an increase in harms associated with methamphetamine use.
And to sort of put it in a more global scale, meth use and its prevalence is estimated, at least in 2019, to be used by about 0.5% of the global population over the age of 15. So that's about 27 million people who had used amphetamines in the past year. And the highest estimated past year prevalence of use of amphetamines worldwide was in North America, followed by the Oceania, which is a region with Australia and New Zealand. Meth is a fairly significant player in the global drug market, where it consists of 13% of drug seizure cases globally. If you eliminated cannabis, which it shouldn't be included anyways, it is the biggest illicit drug type seized. Meth and amphetamine use has been increasing globally, where use of amphetamines in North America remains high, and meth use has increased in the United States. There have been stable trends overall in terms of the other countries around the world. And over the past 24 years, it was found that amphetamine type stimulants have been increasing in prevalence and in consumption, where one can see that major markets and areas of meth production are North America and Asia. Meth use has been growing globally, where crystal meth is on the increase in East and Southeast Asia. Data from some parts of Asia and Africa is a little patchy, but overall in the grand scale of things, amphetamine type stimulants have been increasing in use. And that sort of moves on to the next point, which is the current state of meth production. So the global methamphetamine market has been expanding, in particular in the two largest markets, so Southeast Asia and North America. At the same time, most trafficking in methamphetamine does remain to be intra-regional. So that means it's within a region. So for North America, countries within North America get its meth from Mexico, Eastern Asia get its meth from Southeast Asia, Europe and Western Asia gets its meth from Afghanistan and the Middle East. Half of the global supply of meth seized was just in 3 countries. So the United States, Thailand, and Mexico. Most of the meth manufactured in Asia, Oceania, Africa, and many parts of Europe still continues to be derived from precursor materials called pseudoephedrine and ephedrine. In contrast to previous decades, though, meth has been moving away from the use of these materials towards PTP, which is another way to make meth, which is becoming really popular in Mexico and some parts of Europe, where there are large-scale industry labs. And there have been attempts to illicitly manufacture ephedrine and pseudoephedrine from chemicals that aren't internationally regulated. And what's been found is, at least in Afghanistan, is that they're able to manufacture ephedrine from a locally grown plant called ephedra, and that can be used to produce meth. And due to having that plant, they're able to cultivate them and basically negate the need to use the precursor material that other countries do have to use. And this makes it cheaper to manufacture in Afghanistan. So what we might actually see in the future is that Afghanistan might become a bigger player in the methamphetamine production scene, where it's a lot cheaper to produce methamphetamine compared to, let's say, Myanmar from Southeast Asia. And that sort of moves on to my next point with meth production and supply. The number of dismantled meth labs is decreasing while the methamphetamine manufacturing is spreading across the world. So a major trend over the past decade has been a reported decline in the number of meth labs, falling from about 10,000 in 2010 to close to 1,600 in 2019. However, at the same time, data also shows that meth manufacture is already a widespread phenomenon and is found in an increasing amount of countries or number of countries. So with that said, this sort of suggests that even though the overall number of labs being dismantled or falling, the manufacture of meth may have already spread geographically and is a global phenomenon now. So a possible shift towards fewer labs with greater output in parallel to a general shift in manufactured countries with more regulations may also explain the decrease in the number of labs being dismantled. But that's sort of like what's being suggested so far. Another big point is the focus of methamphetamine seizure, where law enforcement is focusing on seizing the end product, the product which is meth, and there hasn't been a lot of like movement towards seizing the precursor materials by them anymore. This can be reflected in the sense that precursor materials may be harder to detect now. Law enforcement may just not be interested in seizing the precursor material anymore, or that there are unregulated precursor materials being trafficked around the market that legislators and regulators have not been able to catch up to. So with that said, with those challenges, it basically shows that meth manufacturers are becoming smarter in the sense that they can quickly and rapidly adapt to whatever is being thrown at them. So for decades, governments have implemented legislative controls that focused on attempting to keep suppliers from producing meth. In retrospect, from the past decades, these drug control efforts have sort of, failed, where in the midst of domestic manufacturing, when it was at its peak in the past, government officials actually recognized the limitations of their efforts to stop the supply of meth, where they noted that that having increasingly strict chemical controls and efforts by law enforcement, it just adds on to the production of meth in Mexico, depending on what kind of access they have in that country. So they knew that their efforts were going to waste, and there is like recognition that this is sort of a cat and mouse game, where if you were to regulate in your country, another country would fill in that demand. So on top of this, like in order to evade seizures, there's also been increasing adulteration and use of methods that put lives at risk. So there's been news about cutting supplies with harmful chemicals to mask them, criminal gang activities associated with them, trafficking methods that endanger the people who facilitate that, and many other things. There are also increasing levels of overdose death, with meth being a contributing factor, where in the latest BC Coroner's report from January 2022, it was stated that for illicit drug toxicity, that's methamphetamine presence increased from 14% in 2012 to 44% in 2020. So with that said, what needs to happen is that there needs to be a shift in focus on why there might be such a demand, what is contributing to its increasing prevalence and use. The historical development of meth sort of suggests that in the face of ongoing demand for meth, there will always be someone who will supply it. So there needs to be more research on that interrelationship between supply and demand. While the illicit supply of meth may meet existing demand, increases in availability of meth may also be facilitating a growth in demand. So it's like $1 billion question here where we need to figure out why there is a demand and what can be done to sort of reduce that. So we need to factor in things like safe supply, decriminalization, health infrastructure, human nature, social issues, socioeconomic issues, and other things. Possible longitudinal and cross-sectional studies also need to be performed to analyze meth use patterns and how healthcare is being utilized for it. There also needs to be consideration on the war on drugs, especially since a lot of us already sort of acknowledge that it's failed and there's been like a paradigm shift on its futility. Overall, there needs to be a shift towards seeing this as a health issue rather than a criminal one, where there's been so much focus put on the supply side of methamphetamine versus the impacts it has and why is there a demand? Why is there a demand, and why seizing the means of production have not helped? So with that said, I can hand it off to Raha.
Yeah, so just to pause on the discussion around meth, we want to bring up the topic of party drugs and mixing stimulants with opioids. So to talk about cocaine and ecstasy, cocaine is a synthetically produced substance derived from the coca plant. It's typically snorted or smoked in the form of crack cocaine, and it's consumed by about 2% of Canadians in some form. And ecstasy is a substance that acts as both a stimulant and a psychedelic, produces an energizing effect, distortions of time and perception, and enhanced enjoyment of tactile experiences. It's also taken in pill form often, and it's frequently adulterated with amphetamines and other drugs. And less than 1% of Canadians reported using it in the past year. So to talk about some of the trends with respect to party drugs, ecstasy and cocaine use have been fairly stable, where the percentage of users globally has been constant over the past decade. However, there is definitely increasing levels of contamination and adulteration with opioids. We're seeing more and more fentanyl contamination of cocaine and MDMA, which is leading to increasing overdose deaths in the party scene. There's also been a string of reports of fentanyl-laced cocaine in particular, leading to unintentional overdose. So this kind of begs the question, why are they cutting cocaine with opioids? There's several reasons why this might be the case, including budgetary reasons, potency, the effects it might give, cost cutting, etc. So we can infer that there could be malicious intent and improper packaging. There are suggestions that dealers are intentionally cutting fentanyl into their cocaine supply because fentanyl is, after all, a relatively cheaper substance. And it's also highly addictive, which means drug cartels can stretch out their product by mixing in the synthetic opioid and kind of still yield the same effect and street price. So it could also be just general sloppiness on the part of the dealers, where running a drug dealing business may not have the highest safety standards, and instruments might not be properly cleaned, and there can be cross-contamination in that aspect as well. So yeah, to talk a little bit about polysubstance use, aside from questioning as to why cocaine is being laced with opioids, there is increasing polysubstance use seen among people who use drugs as well. So with polysubstance use, we mean the use of both stimulants and opioids together. So this can be something like heroin and cocaine being used concurrently. And so with polysubstance use, questions arise on why would one use stimulants and opioids together and what impacts would arise from doing that. So using both can feel good. People say that using opioids and stimulants at the same time produces a greater effect than either on their own. So we know that one drug may enhance the effects of the, one drug may enhance the effects of the other. So for example, people report that methamphetamine prolongs the effect of opioids. So this increases the amount of time before a person goes into opioid withdrawal. People may also use one drug to temper negative effects of the other, such as countering the sedative effects of opioids by taking stimulants. And they may also use opioids to counter the feeling of being on edge from stimulants, especially as a person's coming down. So drug availability, or sometimes lack thereof, may also influence people's tendencies to substitute one drug to counteract or help manage their withdrawal symptoms. And finally, co-use may also be a product of environmental factors, where both substances are highly available in the current environment, and this may predict the use of both. So there are definitely many negative impacts of co-use found in the literature. So yeah, the person doing speedballs will always guarantee some type of high, but it also increases the risk of negative side effects. So when meth and heroin are combined, for example, it's difficult to determine when too much of either is taken. So you're kind of rolling the dice in a sense, where this lack of awareness can increase the chances of a fatal overdose. Respiratory failure in particular, it's particularly likely with speedballs because the effects of stimulants wear off more quickly than the effects of opioids. So there is a mistaken belief held by some that if you mix heroin and meth, you can avoid overdosing because they counter each other. But if anything, it can make it more difficult for the emergency responder in this scenario to determine what kind of overdose they might be experiencing. And it might be difficult to manage the case because the protocols for responding to a stimulant versus an opioid overdose are completely different.
So this sort of moves on to our next section with the opioid crisis in the context of stimulants. So I guess like at this point, you're probably wondering, why did we go through the history of meth and touch on party drugs as well as the co-use of stimulants with opioids? So given that this presentation is about stimulants in the overdose crisis, it would be highly relevant to see if there are any parallels or mistakes being made again from what we know is a mature stimulant drug market compared to the emerging synthetic opioid drug market. So in our paper that we're currently working on, we're currently investigating this, but so far we've found that we're making similar mistakes again. Those mistakes include playing the same cat and mouse game again with trying to regulate precursor material to fentanyl and other synthetic opioids. With regulations, manufacturers find alternative methods in producing synthetic opioids. Traffickers hide illicit drugs and precursors in legitimate product shipments like rice, and attempt to move illicit products with new tech, and alter the physical nature to evade detection. So we've seen this with meth, where instead of having it in solid form, you can transport it in its liquid form, which could make it harder to detect. What we're seeing now with fentanyl and synthetic opioids is the same focus on supply, although there has been some movement related to harm reduction with naloxone and clean needles and syringes. So got to give some credit to that. And the meth problem we did talk about highlights the challenges inherent to addressing international issues. The opioid crisis is an international issue in the same sense, where multiple nations are involved in trafficking and production, many of which also have a hand in meth trafficking and production. In an increasingly connected, globalized world, those engaged in illicit trafficking have managed to develop, maintain, and sustain connections across national boundaries. The trafficking and production are particularly attractive to those involved in the synthetic drug trade, due to in part with the reality of this being a business where making synthetic drugs are relatively easy to produce and highly profitable. This is true for meth and is also a reality for fentanyl. Fentanyl is cheaper to produce than heroin while also being more potent. If you're a business, it would make sense to make fentanyl if your goals are to make money. Essentially, my point is that the stimulant market and how we've handled it in the past can be used as a blueprint in what we shouldn't do. And if we don't use what we know from the past to our advantage, the past history of the stimulant market may also serve as a blueprint to the emergent synthetic opioid drug market. It's as if history repeats itself when things are sort of left unchecked.
Yeah, so now we kind of want to touch on a really important paper by Fisher et al. That was published last year, and it's titled Resurgent Twin or Silent Epidemic, a select data overview and observations on increasing psychostimulant use and harms in North America. So essentially the paper talks about how in the 2000s there was increasing prevalence of psychostimulants like crack cocaine, methamphetamine, so the increasing prevalence of their use and related harms, and how this included severe adverse health outcomes. This was observed among mostly marginalized populations of persons using illicit drugs in North America. So this increased prevalence underscored an urgent need for intervention options towards improved prevention and treatment. However, by about 2010, the opioid crisis, featuring unprecedented use and a public health burden and crisis, it had accelerated into full force in North America at that time. So this kind of largely muted attention to the psychostimulant issue until recently. So recent surveillance data on drug use and related mortality and morbidity from the present decade has documented a marked resurgence of psychostimulant use and harms, especially in at-risk populations, in combination opioids across North America. So this kind of resulted in a twin epidemic comprised of opioids and psychostimulants. So kind of the take-home message for this, from this paper that we learned, is that a phenomenon characterized by some observers as the twin epidemic of opioid and psychostimulant use can also be characterized as a possible fourth wave of the opioid epidemic.
Yeah, and just to add on to what Raha said about the potential for a fourth wave of the overdose crisis or opioid epidemic, there have also been 3 waves for those who might not be familiar with it. So the first wave was the prescription opioid, increasing prescription opioid use in the late 90s and 2000s, which led to an increase in overdose. In 2010, there was increasing heroin use that led to rapid increases in overdose death. And in 2013, synthetic opioids sort of hit the market, especially fentanyl, which led to significant increases in overdose death. So with the focus of this being a twin epidemic, there is rumblings about this potential for a fourth wave of the overdose crisis. To sort of sum up what we know, stimulants like meth continues to be among the most prevalent substances in the North American illicit drug market. Meth use has increased significantly among people with existing opioid use disorder, and there have been significant increases in polysubstance use with fentanyl and meth or coke. Though stimulant use has been prevalent, treatment options have never been truly available, and needs related to stimulant use have never been appropriately addressed or fully realized. So there is a need to recognize the explosion in meth and cocaine related mortalities and to develop necessary treatment options for stimulant withdrawal and crisis management, which are further complicated by fentanyl and high potent opioids.
So we kind of want to wrap up our discussion about the stimulant market with what can be done. So we suggest that though the rise in methamphetamine harms observed over the last 5 to 10 years is objectively not as great as those associated with opioids, we suggest that this increase should not be ignored. So the federal government could capitalize on the investments that they've already made to address the opioid crisis by using them to address the increase in the use of methamphetamines as well. So some measures that we've included on the slides would be to continue prioritizing and investing in better data and knowledge sharing on drug use and harms in Canada through the continued development of the Canadian Drugs Observatory and just supporting other research efforts. Also investing upstream to reduce inequities in the social determinants of health and to increase resiliency and self-efficacy in youth in particular is really important. Reducing stigma by promoting understanding of substance use as a health issue on a global and national scale is always a pressing concern, and it should be addressed as well. increasing the availability and accessibility of an evidence-informed, client-centered continuum of services and supports. This one in particular has been one of my main takeaways from this conference, and I hope to see it being put into practice in more ways. And supporting interventions to reduce harms specific to methamphetamine use, such as outreach education, needle exchange, stems, pipes that reduce burns and cuts, and other methods to reduce the spread of communicable disease. So yeah, we've seen these efforts be implemented and just continuing and maximizing these efforts as well. And finally, to invest in low threshold housing. So to kind of, oh, okay. Yeah. So you can talk about this last slide, Gurpreet.
Sure. So for our last slide, we just sort of wanted to plug in the paper that we're currently working on, where it's called The Methamphetamine and Party Drug Industry as a Blueprint for Future Drug Markets. So basically whatever's been sort of talked throughout this workshop is what we're sort of hoping to translate, as well as, you know, do a further deep dive on, where a lot of us are focusing on how the stimulant market, the illicit stimulant drug market came to be what it is, especially from the past 10 years, and what kind of takeaways do we have, and how we can sort of translate that to what we should do with the emergent synthetic opioid drug market, since I'm sure that a lot of you have noticed that synthetic opioid use is increasing and its availability is also increasing. But yeah, that's pretty much it from our end. So yeah, we would like to thank you for attending our workshop, and we're wondering if you have any questions.
Feel free to type your questions in the chat, but also if you feel comfortable to unmute yourself and ask questions that way. I'm also going to be monitoring the Who chat, so yeah.
Yeah, okay, so I see that there's a question from Trudy. Oh wait, did you answer it? I don't know. Many people I work with use meth to counteract opioid cycle with up, down, up, down. Could that be why there is a demand?
Yeah, definitely, Trudy. I think I touched on this point when I was talking about polysubstance use. So for sure, there are some preconceived notions that by using stimulants to counter the effects of opioids, they're kind of finding a loophole. But kind of what that is doing is ignoring like the danger in doing that. So when it comes to responding to someone who might have overdosed while taking both stimulant and the opioid, it just makes things a little bit harder. Yeah.
Oh, and she just replied that just after I asked. He did. Thank you.
Okay, so yeah, a question from Tracy asks, one of your solutions is to increase resiliency in youth. Any ideas on how to do that? That's a really, really good question.
Sorry, I'm trying to think about it.
Yeah.
So increasing resiliency in youth. So yeah, I mean, like we're seeing things right now with public health campaigns, at least on platforms focused for youth, like YouTube, TikTok, and stuff, that are trying to raise, I guess, awareness or educate people on those platforms. So there's that. In terms of resiliency, it's, you know, it's like the supports we provide with individualized treatment and care, and yeah.
I think also one of my other main takeaways from this conference has been when it comes to youth specifically, the current systems of care that are in place are often fragmented, and they're underfunded, you know, their wait lists are too long to access the care that they need. So to set up better circumstances where youth are able to get the treatment that they need through various different ways in terms of like social treatment, mental health treatment, substance use treatment, housing, is important. So it's important to build a strong foundation for youth to build resiliency, because we know that substance use early on in life predicts negative outcomes later on. So yeah.
Oh yeah, I should probably stop recording.